My first question for you, what would you like the biggest takeaways from your study into non-infectious uveitis to be?
That long-term control of uveitis is critical, and you can achieve that with either systemic therapy or with local therapy. And then this was specifically looking at what happens in a trial with local therapy, and how do eyes that did not get the long-term therapy do? So eyes that were treated with more of the standard of care during this trial, so since it was the fellow eye, how do they do over time? And what we found was that the untreated fellow eye, and not really untreated because they were getting standard of care therapy with short duration local therapy, tend to do worse in terms of visual acuity outcomes, number of recurrences of uveitis, and total number of rescue therapies needed over the 3 years.
Okay, and now what can we learn by the disease progression that we saw in the fellow eye during the study?
Well, we know that that uveitis is a blinding disease, or especially posterior uveitis over time, and that intermittent pulse therapy, which was what these patients received with rescue therapy, tends to not do as well, and you get this over time loss of vision compared to long-term stable control of inflammation.
Okay, now were there any strengths or limitations within your study that you would like to touch on that you weren't maybe
Sure.
able to include in the abstract?
So there's a couple things. One is there's a few caveats. So the fellow eyes, by definition, tend to be less severe because you were required to choose the more severe eye for study entry. So despite them being the less involved eye and them being the less severe eye, patients still tended to do worse. And I think some of the data that I was going to show at ARVO highlights that. But the strengths are that this was part of a clinical trial. So these patients were very, very closely followed. Recurrences in the fellow eye were treated, and these patients were seen more frequently than they would have in real world practice. The disadvantage is this is retrospective, and this is a sub-analysis of data that was available. It is not a prospective analysis of what happens to eyes over time. It's really a retrospective analysis of clinical trial data.
Okay, and now was there anything else that you would like to touch on from the study that you think it's important for clinicians to know when looking at this data?
Yeah, I think that the most important thing is to recognize that posterior uveitis requires long-term control, and you can achieve it in many different ways. But local therapy, especially with the longer duration therapies that we now have available, is a great option. Uh, but it does have some side effects in terms of cataract formation and elevated IOP. But overall, these patients tend to do better with long-term sustained control of their uveitis.